Hi, everyone. My name is Brittany. As all of you know, I'm a nurse. I work on the postpartum floor at Carle Hospital in Champaign. My job here is to take care of families and infants directly after childbirth. Working in this role over the past year, I've seen many beautiful and smooth recoveries after welcoming a new baby into the world, but I've also seen some difficult recoveries with unexpected outcomes. Aside from this, I've also seen many women and infants affected by complications in labor as we work closely with the labor and delivery staff. My experience as a nurse is what makes me passionate about my topic and why I believe that hospital births are better than home births. About 99% of women present to the hospital to deliver, but home birth numbers are on the increase lately, especially with COVID. Many low-risk women are consulting with midwives to make a plan to deliver at home. Regardless where they decide to give birth, they're typically looking for a supportive, respectful, and loving environment around them. With regards to this, many healthy and low-risk women are having their first ever hospital experience when they present to the hospital for labor and delivery. And they are scared and uncomfortable and afraid that they're not going to have their basic needs met. They want little intervention from staff typically. They want to feel safe, they want to feel supported. And most of them are fearful of unresponsive care, afraid of embarrassment, and have a lower perception of risks that are associated with childbirth, just because when it comes to pregnancy and childbirth, many are not really educated since it's a natural process that many people go through. The low perception risk of pregnancy and childbirth is one of the biggest reasons why people choose to deliver at home. A doctor named Dr. Ghaffari, which is a perinatologist at the University of California, says it's very hard to determine which patients are going to have an obstetric emergency, which is very true. You can have a high-risk patient who is almost down in the book that could possibly have everything you could ever think of, and nothing happens to them. And you can have a low-risk patient who you don't think anything will happen, and they end up with like severe blood pressures or bleeding out. So between 23 and 37% of first-time moms attempting home birth actually end up transferring to the hospital. The largest reason for this is the baby not moving down in the birth canal, which can be caused by pelvic position, the size of an infant if a mom were to have diabetes, the age of the infant, and even a complication known as shoulder dystocia. This is where the baby's shoulder gets stuck behind the mother's pubic bone and doesn't allow for them to come out. These are all extremely dangerous complications. They can compromise the health of mom and baby and cause compression to the umbilical cord, which can cut off the baby's oxygen supply and actually end in fetal death. With these complications in mind, obviously, I mean, if that happened to me, I would rather be in a hospital than in my living room. So if you're delivering in the hospital, the healthcare professionals are there. The NICU is there, which is the neonatal intensive unit. They're seconds away, just one call away, so they can be there if those emergencies happen. I cannot imagine the fear in this moment. I don't have any kids, but as a nurse and seeing what happens, I just cannot imagine that fear that you would have that something would go wrong. I feel like that would be so much more lessened if you were in a skilled facility surrounded by professionals. Apart from the complications and dangers that can happen to an infant in delivery, there are also separate complications for the mother. These mostly occur during the final stage of labor when the mom's pushing, and then can also occur during the first 6 weeks after the baby's born. These can include things like postpartum hemorrhage, which is the loss of excessive blood with or after delivery, and this is usually above 1 liter of blood. Another risk is tearing due to delivery, which can result from big babies or pelvic position, and these can vary from small abrasions all the way to 4th-degree tears that extend all the way through the rectum. Moms can also even get postpartum preeclampsia, which is a condition related to high blood pressure that can result in seizures and death. In my position, I've seen a lot of these things occur, sadly, and they honestly occur more often than you would think they would, and sometimes even to low-risk patients who we would never expect it would happen to. These complications are almost always required medical intervention like stitches, blood, iron infusions, or even blood pressure medications to control. which are not available at home, obviously. Knowing all of this information, it's important to weigh the pros and cons of each type of delivery, the hospital delivery and the at-home delivery. The pros of at-home delivery is that you're able to decide your environment, you're the boss, you get to choose who's there, you get to tell who you don't want to be there to leave. You can construct a birth plan that you can follow to a T if you would like without anyone telling you something you can't do. And with the mom as the boss of the environment, she's much more likely to follow her plan and follow through with a healthy and smooth delivery. Typically, they use midwives who are professionals who attend to home births. They believe in low intervention deliveries as long as the environment is safe and everything's going well. And obviously, if something were to go wrong, they'd be the professional who would say, hey, like, let's go to the hospital. We need some more people. Another cons to home deliveries are that you're at a higher risk, obviously, of not being in that trained professional environment. So if anything does go wrong, you have to take the time to get transported there rather than just being there already. Another con is cost. Typically, insurances don't cover the cost of the midwives when you're at home because it's a more high-risk environment. When it comes to hospital deliveries, cons of that could be the fact that there's a greater chance of episiotomy, which is when they have to make some cuts for the baby to fit out. Higher chance for vacuum delivery when they have to help pull the baby out, and a higher risk for cesarean section, obviously. This obviously depends on the patient's situation and the physician, but in this environment where those things are available, they're more likely to intervene. Pros to a hospital delivery is they're the safest place to deliver because everyone who has all the knowledge is there. Infant mortality rates are reduced by 93%, which means about every 7 infants out of 1,000 pass away in a hospital. If any complications arise, the trained professionals are there. There's extra support offered for days after delivery on breastfeeding and infant care, and there's lactation consultants there too who can help. Some hospitals even now offer like hydrotherapy or jacuzzi tubs to help you labor, which is something that's on a lot of women's birth plan. And like being at home, you can use midwives in the hospital and you can bring your birth plan in and we work with you as good as we can. So in conclusion, hospital births are better and safer than home births. As a healthcare professional myself, I know that it is not possible to predict which patients, low or high risk, will experience complications. When delivering at home, if a complication happens, transportation may not be fast enough to save the mom or the baby. Many feel more comfortable at home, but ultimately the hospital is safer. And at the hospital, it's never our intention to make anyone feel uncomfortable or scared. And as a nurse, I just want all my patients to have a happy delivery and a safe recovery and a supported environment. Thank you.
I don't want to have a baby now. Thanks, though.
Yeah.